Welcome to our explainer video on the donut hole. And so as a retail pharmacist, I often hear about the donut hole. Everybody wants to know what it is, how do I get in it, how do I get out of it. And so I'm going to leverage my expertise as a former actual retail pharmacist, an expert in Medicare from working at a Medicare health plan, and I sell Medicare insurance to help explain to you today what the donut hole is. So, hopefully at the end of this video, you will be able to look like the gentleman on the screen and you will know more about the donut hole and feel more comfortable if you actually have to get into it. So, what are you actually going to learn? So, we're going to go over what is the donut hole, how do you get into it, and how do you get out of it. We're going to walk through an actual example, and then I'm going to show you how you can use your explanation of benefits, also known as the EOB, to know more about the donut hole. Now, good thing I am an honest, transparent new YouTuber, because guess what? You could stop this video right now, because guess what? The donut hole is going away for January 1, 2025. So it will no longer exist. However, if you just curious and want to know about the donut hole, or maybe you may get into it or already into it for 2024, please stay tuned as we walk through it. So in order for us to understand the donut hole, we have to understand how we actually go through the phases. So there are 4 stages to the Medicare Prescription Part D plan. You have the deductible phase, the initial coverage limit, then you have the coverage gap known as the donut hole, and then you have catastrophic. So the donut hole is our 3rd phase, which is the coverage gap or donut hole. In order for you to move through these phases, we have to keep track of 2 buckets of money. That first bucket of money is going to be total drug spend, and that second bucket of money is going to be true out-of-pocket, known as true. Okay, so in order for you to get into the donut hole, you have to have a total drug spend in 2024 of $5,030. Now, total drug spend is actually the cost of the medication. Now, as an independent pharmacy owner, that's not the cost that it costs me to actually pay and acquire the drug. It's what the insurance company has negotiated with my pharmacy to say every time you dispense drug A, I am going to give you X amount of dollars, okay? And so you as the member pays part of that, the plan may pay part of it, and there's some other entities that may pay part of it. All of that goes towards the total cost of the drug, and that's going to be our total drug spend bucket. Our second bucket is going to be known as true. This is true out of pocket. What true out of pocket is, or the true, is how much you paid out of your pocket. So in the deductible phase, you have a deductible for your plan 100% of the cost until you meet the deductible, and then the plan kicks in. All the monies that you pay towards your deductible, all the monies you paid in the initial coverage phase, which is usually your copay or if there's a co-insurance, all that money that you actually paid out of your pocket goes towards your true, which is known as your true out of pocket. Also, what others pay on your behalf. So if you get extra help from the government, known as low-income cost sharing, whatever the government pays on your behalf, that too gets applied to true. What we're going to learn in this video, because we're talking about the donut hole, is also what the drug manufacturer pays on your behalf when you're in the donut hole will also count towards true. Okay? So the total drug spend for 2024 is $5,030. Once your total drug costs get to that amount, you're going to fall into the donut hole. Once you are in the donut hole, you get out when you're true out of pocket, which is what you yourself paid on your behalf, plus what others paid on your behalf, reach $8,000, which is the limit for 2024. Then you'll get out of the donut hole and move into catastrophic. So real plain and simple, what you pay and the plan pay makes up your total drug spend. That reaches $5,030. You go into the donut hole. What you and others pay on your behalf, not the plan, reaches their true amount, which is $8,000. Then you get out of the donut hole and move into catastrophic. So let's walk through an actual example. So what you're going to see is a sample plan benefit. And so for this example, I chose to put tier 1 drugs at a copay of $5. And I'm also going to say that this particular plan is going to exclude tier 1 drugs from the coverage gap, okay? Now, what that means is the plan is offering additional gap coverage. So they're saying, hey, member, if you are to make it into the donut hole, you do not have to pay 25% of the cost of these drugs that's on tier 1, unless the 25% is less than what your tier 1 copay is. Then, of course, you would pay the lesser of. Okay, so the reason some of the insurance plans do this is because they want to make sure for certain medications that are tied to quality or star ratings that you don't have any affordability issues. You may receive phone calls or letters encourage you to take your diabetes medication, your blood pressure medication, and your high cholesterol medication. All those are tied to quality scores known as star ratings for your plan. So oftentimes those drugs will be placed on a tier of your list of drugs that is excluded from the coverage gap. For this example, tier 2 drugs are going to be $10, tier 3 drugs are going to be $20. And so in the example, I chose 2 drugs. One's a generic, which is atorvastatin, and the other is a brand name drug, which is Eliquis. Atorvastatin is used for cholesterol. It's going to be on tier 1 for this sample that we're doing, and the drug cost is $50. Now, when I say drug cost, that is not the cost that it costs me as the independent pharmacy owner to purchase the drug. This is how much the insurance company has negotiated with me as the pharmacy owner to say every time you dispense atorvastatin, I will make sure you get $50. And then that $50 is going to be split up between what the plan paid and what the member paid. And if it's a branded drug like the Eliquis in the example, what the manufacturer others paid on their behalf. So always know that the total drug cost may not be the actual cash price. It's the price negotiated between the insurance and the pharmacy. And for this example, atorvastatin is going to be $50. Eliquis is $300. These numbers are totally fictitious. Okay, so the member cost share, let's calculate that one first. I'm going to be speaking in this video as if I'm talking directly to a Medicare beneficiary. So if you are a pharmacist or a pharmacy technician or a clinician and you're trying to learn how you can articulate this to Medicare beneficiaries, hopefully you can see how I'm explaining it to the Medicare beneficiary and then extrapolate that into your own words as you help your patients and customers that may come to your pharmacy counter. So Medicare beneficiary, how much are they going to pay once you get into the donut hole in this example? For the atorvastatin, you're only going to pay your $5 copay. Okay, you're not going to pay 25% of the $50 because 25% of $50 is $12.50. That's more than the $5 copay. The atorvastatin is on tier 1, so remember it's excluded from the coverage gap, or the insurance company has provided additional gap coverage, so therefore you're only going to pay the $5 for the atorvastatin. The Eliquis, on the other hand, the drug cost is $300. It is a brand name drug. It is on tier 3. There is no additional gap coverage, so you as the Medicare beneficiary is responsible for 25% of the cost of that drug. So 25% of $300 is $75, which is going to be your copay, right? So if you as a member went to the pharmacy in this example and you picked up your atorvastatin and your Eliquis while you're in the donut hole, you would be expected to pay the pharmacy $80. All right, let's talk about what the plan pays. So your insurance plan has a portion of these drugs that they have to cover. And so the plan for the atorvastatin is going to pick up the remaining amount of the atorvastatin. In this example, it's going to be $45. And then the Eliquis, the plan is responsible for this year, in 2024, they are responsible for 5% of the cost of the drug. So they're therefore going to pay $15 for the Eliquis. Now, let's move on and see what the manufacturer pays. So the manufacturer of the atorvastatin is not going to pay anything. And why? Atorvastatin is generic. So generic manufacturers do not have to pay in the coverage gap. Only manufacturers of the branded drug. So the atorvastatin is going to have $0 liability from the manufacturer. But for the Eliquis, the drug manufacturer is going to be expected to pay 70% of the $300, which is going to total $210. Okay, so now let's go over what our accumulator buckets are. So remember, that was our total drug spend, and that was our troop or true out of pocket. So the way you're going to get total drug spend is easy. It is going to be the cost of the drug. Total drug spend doesn't care who pays it as long as it gets paid, okay? So the Eliquis is $300, the atorvastatin is $50. So for this example, your total drug spend for this example is $350. That's just how much the drug cost, okay? And then the troop, your true out of pocket, is only going to take into account two of these payers, and that's going to be you as the member and others on your behalf, but that does not include the plan. So what you pay, the $85 plus the $210 that the manufacturer paid for the brand name Eliquis, combined equals $290. That is going to go towards your out of pocket. And remember, now that you are in the donut hole, it is the out-of-pocket or troop that is going to get you to the next phase, which is catastrophic. And you have to hit $8,000 before you can get out of the donut hole and move into catastrophic for 2024. So in this particular example, your total drug spend is $350. That helped to get you into the donut hole. We'll still keep track of it, although it's not going to help you get out. What's going to help you get out is the troop, which you just had $285 applied to troop. And once that hits $8,000, then you are expected to move into the next phase. Okay, so let's use an example EOB that Medicare has online that you can go out and you can look at and you can pull down. And so this says for Birchwood Medicare Plus. This is all made up. You notice it says that this is not a bill, okay, and it'll have your name on it. So in this particular example, it's Jennifer Washington on Example Street. It has her Medicare beneficiary number, what date the notice was actually sent out, and then it has the claims for. So it's telling you what month these drugs were billed for. The explanation of benefits you will receive each month that you actually have medications filled in the prior month. All right, so what we see in this example is you'll notice stage 3 has a black box around it and it looks like it's highlighted. That's because the EOB is telling you that for this particular example, you are in the coverage gap, okay? And so because it's saying that you are in the coverage gap, it's also going to give you a couple of key pieces of information. You will see that your out-of-pocket cost in this example is $3,200. So Jennifer, according to this, from January to March 2024, has already paid $3,200 in out-of-pocket costs. You will also see that her total drug cost or total drug spend is $5,763. Now, if you remember, the drug spend limit for 2024 is $5,030. Because she has exceeded this amount, that is what puts her now into the donut hole or the coverage gap. You will also see, as I have highlighted in the red circle, that the drug manufacturer is going to pay 70% of the cost of the brand drug. So if it was our earlier example, it would have been of the Eliquis. It also tells you that you're going to pay 25% of the cost of your brand and your generic drugs, and the plan is going to pay 5% remaining of the branded drugs and 75% of the generic drugs. So it tells you that in that little bubble, and it also tells you that you stay in this stage until your out-of-pocket costs reach $8,000. And then it says, as of the date of this particular EOB, which has claims through March, your out-of-pocket costs were $3,200, which we also see in the table above. What I love about the EOB, it tells you not only where you're at, but it also tells you how far you have to go. So you see stage 4 says catastrophic. You get there when your out-of-pocket has reached $8,000. Right under that, it says what happens next, because you've already spent $3,200 and you've got to get to $8,000. You got another $4,800 to spend until you get out of the donut hole and move into catastrophic. So using your explanation of benefit or your EOB will allow you to see how much each of your drugs actually contributed towards the donut hole. You can actually see what the drug costs are, and then you can calculate from there. But even more importantly, it tells you how much you've already spent towards that accumulator bucket of total drug spend and troop. But if you're in the donut hole, the one that matters to you most is the troop. So it tells you what that bucket is in order for you to get out. So side note for my pharmacists, pharmacy technicians, you may not have all this available to you. If you encourage your customers to bring to you your EOB, you can actually then look at it and say, hey, Miss Jennifer, it looks like you've got $4,800 left before you get out of the donut hole. I can tell you the transactions you had today, the particular drug cost was X, Y, and Z, if you have that information available. And then now you can apply the percentages to roughly know how much is going to go towards their actual troop. All right, so wrapping this up, the coverage gap or donut hole, remember plans may exclude certain drugs or certain tiers of drugs from the coverage gap, which just means they call it additional gap coverage. As the member, you're going to pay 25% of the drug cost, regardless if it's a brand name drug or generic when you hit the donut hole. Manufacturers are only on the hook for paying for branded drugs. They'll pay 70% of the cost once they're in the donut hole. The plan will pay 5% of that brand drug cost, which is what's left. And then for generic drugs, they'll pay 75%. And I want you to remember that the 70% that the manufacturer paid plus the 25% that you paid, that 95% of brand drug costs will go towards your troop to get you out of the donut hole and into catastrophic. The 5% that the plan paid will not count. Accumulating total drug spend, that bucket no longer matters. It mattered to get you from the initial coverage into donut hole, but we will, as a plan, continue to accumulate and keep that bucket. And once the troop limit that's set by Medicare is met, then you move to catastrophic. But keep in mind, just because you got in the donut hole does not mean you're going to get out of the donut hole, because all of this resets at the beginning of the year. So if you get into the donut hole too late in the year, you do not have enough drug claims to get you out of it, you'll just stay in the donut hole until the end of the year, and then it will repeat and start all over in January. However, that's not the case for January 2025, because as you learned earlier, the donut hole is going away. Some additional points that I wanted to go over is that not all members, again, will make it through all 4 phases. So sometimes there is no deductible, and sometimes there may be a deductible, but you may not make it out of it because you may just not take a lot of drugs. Initial coverage limit, you could stay there for forever. The donut hole, you could stay for forever. And then some folks that get into the donut hole may make it to catastrophic, but it does not mean you'll make it through all 4 phases. Plans offer additional gap coverage that we already talked about. If you as a member decide to change plans for whatever reason, you decide, I don't want to stay in this plan anymore, you use a special enrollment period and you move into another plan, those accumulator buckets, total drug spend and true out of pocket, will follow you to the next plan. So they do not start over. Whatever you've accumulated in your prior plan, that will just get transferred over to the new plan, and you'll pick right back up where you left off. So if you're trying to leave your plan because you've fallen in the donut hole and think it's going to start over if you move somewhere else, you're in for a big surprise. It follows you right where you are. And then again, to close all this out, this will reset at the beginning of the plan year. But for 2025, there's no donut hole reset. You'll just go from deductible, initial, to catastrophic. And a lot more to come in 2025 due to the Inflation Reduction Act. However, that's going to be in another video. So hopefully today this was helpful in you understanding what the donut hole is, how you get into it, how you get out of it, even if it's only a few more months left in 2024.